Hello everyone, good evening. Welcome to the wellness session organized by Policybazaar through IIT Kharagpur Alumni Foundation of India. I welcome Dr. Vineet Banga for this cancer awareness session, and I hope you all like the session. Over to you, Dr. Vineet.
Thank you, Sampanna. Very good afternoon. I hope I'm audible
Yes, Dr. Vineet, you're audible.
and the first slide is visible.
Yes.
Okay, thank you. So welcome all the participants. Today we are going to talk on a very important issue. Why? Because incidence is increasing, and it's not just increasing, it is increasing at a very fast speed, and that is the cancer. Almost every family we see now one or two patients of cancer. So why we are talking? Because incidence of cancer is increasing. It's not just normal increase. The way population is increasing, it's increasing rampantly. Very important part that we'll cover today also. Prevention is better than cure. We say that's true for every disease, but for cancers again that is very important, because almost one-fourth of the cancers, 27% cancers are just related to tobacco and smoking. So if we just remove this tobacco and smoking, means one-fourth of the cancer load has been reduced, will be reduced from the hospital. You can imagine the huge burden on the hospitals or the healthcares and huge economic burden. Cancer is curable or not curable, treatable or not treatable? Yes, if diagnosed early, it responds better to treatment. At least this way we can say yes, early stage, early diagnosis will definitely respond better to treatment. So cancer is preventable, especially related to tobacco, smoking, alcohol. Cancer is treatable and managed effectively if diagnosed early. That's a very good catch sign if we diagnose it early. How we can diagnose early, we'll be talking in this session in detail. And cancer is a huge economic burden on the individual, on the family, on the government, and the whole world. It is a huge economic burden. So we need to reduce the incidence of cancers. As per the report of the World Health Organization, in 2020, they released a report. They said 1 in 10 Indian will develop cancer in their lifetime and 1 in 15 will die of it. Almost 10%. This is very high incidence. And as per the cancer registry data, we record the cancer cases, there are about 8 lakh new cancer cases in India every year. And what we expect that this is increasing at a very fast speed. So there will be almost 3 times this, almost 24 lakh cases. These are very few cases which are recorded. Otherwise, there are huge population which is there in the rural area which is not getting recorded also. And in India, the sharp rise in cancers are associated with factors like overweight. Overweight is going to become a major problem. And the saying is that by 2050, almost 40 to 50% population will be overweight. So overweight is a very big problem. Tobacco, alcohol, at present again a very big problem. Sedentary lifestyle and lack of exercise. Especially in the last 5-10 years, we are seeing this. It's more common now, and especially after COVID, when the work from home or work from anywhere has started, people are becoming further more sedentary and there's hardly any physical activity. So all these lifestyle, so cancer is one of those lifestyle diseases that we call it nowadays. And many of the cancers are preventable if modify their lifestyle, avoid these harmful habits, which leads to increased incidence of this cancer. So if we remove this sedentary lifestyle from our lifestyle, we start doing physical activity, stop taking tobacco, stop smoking, stop alcohol, and control the weight, definitely incidence of cancer will come down. So considering this fact that cancer is very common, cancer is preventable, treatable at early stage especially, the objectives of today's session is to sensitize all the participants about the different types of cancers in the body. There are so many organs and every organ has so many types. I cannot cover each and every type, but definitely more common types, which is most common in men or women, I'll be discussing those cancers. And what are the risk factors? What are the causes of the cancers? Because unless we know the cause, we cannot prevent it. So we will talk about the various causes or the risk factors and how they can be prevented. If you remember, I talked early diagnosis is very crucial. So are there some early signs so that the person can know, yes, I may have a cancer, so I may need to go to doctor at early stage. So we will be talking of the early warning signs. Please remember, early warning signs does not mean that cancer is there. Early warning sign only just gives you warn. They go to a doctor, get it confirmed. If cancer, treat at an early stage. If not cancer, then we don't be worried about it. Then, is there any role of vaccine in cancer? Every day, some days we read in newspaper, okay, this country has made a vaccine for the cancer. Which cancers there is a vaccine? There are some cancers in which vaccine is effective, but not all the cancers are preventable by vaccines till today at least. And then we'll have a word about quality of life in the cancer care, because that is very important, because everybody cannot tolerate that chemotherapy or radiotherapy, and especially in the later stage of the life when the cancer is diagnosed in the late stage, then again it becomes very difficult. So considering these objectives, first let's talk about what is actually a cancer. Now cancer is a term that is used for uncontrolled proliferation of abnormal cells. Medically, if we talk, there are two abnormality. One thing is cell is becoming abnormal, so there is no normal cell. These are abnormal cell in the body. How it forms will we talk. This cell is abnormal. Why and how it is abnormal? It is abnormal that it multiplies very fast, uncontrolled. There is no control. It proliferates very fast, multiply very fast. Any cell which will multiply very fast will give rise to a separate mass or a lump or a ulcer. That is a cancer. So why say in the cancer there is a lump form, there is a mass form. That mass is of abnormal cells. Why mass? Separate mass, because they are multiplying very, very fast. It's common term for all malignant tumors in the body. Means they are, when we say tumor, tumor can be benign, which does not multiply very fast, and the cells are just normal, and when the cells are abnormal, then it becomes a malignant and there is no control. So all tumors are not cancer. It is malignant tumors are the cancers. Now this is a very important diagram, and I will explain you how cancer forms and what happens. This is perfectly normal structure. In the body, there are normal cells. And when we say cancer starts from abnormal cell, so this is one cell has become abnormal. Now, why this is abnormal? This may be many factors. This may be genetic, family cancer incidence. There may be viral infections. There may be pollution. There may be chemical. There are radiation. There are some pesticides, or there may be numerous other factors that lead to abnormal cell formation. Now, this is abnormal cell. Because this is abnormal cell and it multiplies very fast, so it gives rise to a mass. This is the early stage, what we call in situ carcinoma. Carcinoma is one type of the cancers. So in situ means that is inside the organ from where it started. That is like inside. So it's very early stage. If we remove this whole cancer, the treatment is done. So very early stage. Now these cells are multiplying very, very fast. So slowly, there is no space in the organ. They try to go outside the organ. So that is called invasive carcinoma. Means they have invaded, they have gone out of that organ from where it arises. So slowly it has going out. And we must have heard of it, that cancer started in the intestine, that goes to the liver. Cancer started in the breast and then goes to the brain. So this means it goes to distant site. Now, it started going to some distant site, to different organs, and then in between it goes to the blood vessels. And then moment these cancer cells, atypical cells, abnormal cells gets entry into the blood. From the blood, they can go to any other site, and that is called met or metastasis. Now, what is metastasis means? Arises in the somewhere else and deposit in some other organs. And these organs, common organs where the cells cancer spread is the liver, brain, bone, and lungs. These are the common sites where we can see secondary carcinoma or a metastasis cancers. Now, what is secondary means? It has not started in the liver, but it has come from the intestine. It has not started in the liver, but has maybe come from the breast. So this is the when it has spread to distant organs, that is the late stage. Now, surgery cannot be done because you can't remove the tumor. You can't remove the tumor from the liver. You can't remove the tumor from the lungs. It is very difficult. It has spread to so many sites. Then surgery is not the treatment. That's why early stage, when it has limited to the organs or just started, then it is a good prognosis, means because we can treat it. So based on this, we call it stages, various stages of the cancers. And when we say stages comes how early, at the early stage or a distant spread, extreme. So this is the early stage where a mass is present just to the organ, and then it remains localized, then to the nearby areas, and then distant spread, 1, 2, 3, 4. Now, very, very important stage when patient comes in the late stage or doctor says it is stage 4. Stage 4 means it has already spread to distant site. Now, how it is important for us? It is important for us because how long person will survive, that will depend on the stages. What is the effect of treatment? Now, in stage 1, effect of treatment is very good. Almost 90 to 95% of people survive for at least 5 years. This is the way we report the survival rate in the cancers. While in the distant spread stage 4, only 20% survive for 5 years. So there's a huge difference in the survival. So prognosis of the people who are in the late stage, distant, their already cancer is distant spread, is very bad. Now, what are the types of cancers? There are various types of cancers. I said again, every organ can have many types, and there are so many organs. But most common in females, if we talk, that is the most common cancer of the breast. Again, its incidence is rising, especially in the metro cities. Almost 14 to 15% cancer is among the cancer is the breast cancers. Apart from this, the cancer of the female genital tract, the cervix, the uterus, ovary, again, that are common in the women. And it's not that lung cancers, liver, thyroid, mouth, intestine are not seen. They are also seen. Other cancers are also seen, but most common is the breast and then the female genital tract. And while when we talk of the men, most common cancer is the lung. Again, it's related with the smoking. Smoking is more common in the men, and the lungs cancer is related with the smoking. Apart from this, the liver, and again, liver cancer is related with alcohol. Mouth is with the mouth cancers are basically with the tobacco. Stomach, esophagus, food pipe cancers are also seen. Apart from this, the male genital cancers like prostate, especially in the after 50 years, and the testicular cancers, which maybe they are even 30, 40 years, that is also seen. Now, when we talk of the risk factors or the causes, what are the causes of the cancers? Every cancer will have a different types, different cause. Sometimes it's not only one cause, there may be 4 causes or 5 causes, or to be very frank, they're all the risk factors. More the risk factors, more are the chances of developing that cancers. One very important is the genetic. We cannot change a gene, that's a familial, and especially breast cancers are again very, very common in the families. If somebody's mother has a breast cancer, they should go for screening early. Or mother or the maternal side, the sister of your mother, the real sister means anybody has a breast cancer, then one should go about it. Or if there is some familial tumors, familial cancers, definitely one should get screening test early. Environment. Nowadays, if you see, there are so many chemicals, so many pollution factors are there in the environment. And even in Punjab, one village is using a lot of pesticide, and all that pesticide got deposited in the water, and almost 50 to 70% of the population developed the cancers. Again, that is environmental part basically, or the air pollution is again had a very big role. Infections. There are some infections like hepatitis B, which cause liver cancer. There are a human papilloma virus, which leads to the cervical cancers in the women. And both of these cancers, especially these cancers, are preventable because of the vaccine. If you remember, we said vaccine can prevent some cancers. Vaccine prevents these infections. So there's no infection, no cancer. Then there is a hormone. They are particularly related to the ovarian cancers or in the men prostate cancers. So hormone also has a role. Apart from this, a very, very important, which can be changed, which can be modified by the lifestyle, because our lifestyle has changed in last 10 to 15 years like this, that the cancer incidence is increasing. Now, what are those risk factors? Smoking, lung cancer, and it's not only lung cancer, many other cancers are also by smoking. Alcohol, especially the liver cancer. Tobacco, again, cancer of the mouth. Unhealthy diet, very, very important nowadays. Again, we have an unhealthy diet. Last 10-15 years, before this 10-15 years, we were not having cancers of the intestine or the GI. But in the last 10-15 years, especially, our diet has changed to refined flour, maida. We have stopped eating the whole grain cereals or the millets, and we are eating more of a refined flour. Refined flour is unhealthy because there is no fiber in it, and that is predisposing us to cancer of the intestine. And then there is obesity, which leads to the obesity is actually mother of diseases, and it's not one disease, mother of many diseases. Cancer is one of those, because it affects the fat levels, it affects the hormone levels, so it has a influence at many levels. Physical inactivity is a very big factor in causing obesity. So these are the numerous risk factors. And then we said lung cancer, which is the most common cancer in men. When we say lung cancer, it means it is arising in the lungs primarily. But we have seen lung is a site where it is very common site from where it is from many other sites. Cancer also develops goes into the lung, deposit in the lung. So that is called secondary. So lung is a site where we can see primary cancer as well as secondary cancer. Primary means which arises in the lungs, and very common risk factor is the smoking. Secondary means it arises somewhere else, means maybe in the breast, maybe in the intestine, maybe in the stomach, maybe in the skin, and then comes to the lung. Now, we talked smoking is a very important risk factor for the lung cancers, and we just think that smoking leads to the lung cancer, but smoking leads to many more cancers. Smoking leads to the mouth and throat, the food pipe, the larynx, voice box, lungs, liver, stomach, pancreas, intestine, even blood cancers, kidney cancers, the cervical cancer. So almost 9 to 10 types of cancers are because of the smoking. So, and what we are seeing is the incidence of smoking is increasing. And people say that smoking is helping us and relieving the stress. That may be a very moment, and that is actually a wrong feeling, I'll say, because smoking is leading to so many harms. Very high level of stress again is very harmful. That leads to many diseases. So smoking is actually further damaging the body, and we do not know how long one can live. The issue with the smoking is that smoking starts very early. in the school, the teenage, basically it starts. And by the time people come to us with some cancers because of the smoking, it's almost 30 to 40 years, maybe in the 50 years, they have already smoked. So, and by the time then they realize it and they quit smoking, that's a very big time it takes to remove the effects. So, are there effects of quitting smoking? Yes, very, very important. If a person quits smoking, it is beneficial. The effect starts almost immediately, and then it takes time. Now, how long it takes, that depends on the person, for how long that person has smoked. If person has smoked for maybe 2 to 3 years, then the effect will go in maybe one or 2 years. But if a person has smoked for maybe 40, 50 years, the whole effects will go in almost 15-20 years. But definitely, if person quits smoking, there are beneficial effects. So person should not think like this: I have already smoked for 40 years, so there's no point on now quitting. There are definitely beneficial effects. Now the question comes whether active smoking or passive smoking, both are bad or both are good, or active smoking is bad, passive smoking we can't do it, we can't help it. Yes, we can't help it. When there is a pollution, we can't help it. But yes, some things we can do it. Do not sit in the chamber of a person who is smoking. This we can do it. After all, it is our health, and for my health, who is responsible? I am responsible. So at least avoid as much as passive smoking you can, and definitely do not do active smoking. So one very big message for the cancer prevention is say no to smoking. Yourself, friends, or family, pass this message that smoking is very bad. Now, how we can diagnose the lung cancer? Actually, just to tell you basically, so that you are aware how patient presents and what are the features, how we go further. Now, if a person is smoking for maybe 40, 50 years and develops the cough may be any infection or maybe allergic, but along with the cough, it is a hoarseness. Hoarseness means heaviness of the voice. A person says, I am having a cough, and there is a change in the voice for last 1 month or 2 months. There is a significant weight loss. Not doing dieting, but person gets a weight loss. And when it coughs, there is sputum comes, and there is a blood in the cough. So if a person, especially those who have smoked for a long time, they develop the weight loss, they develop the hoarseness, they have a cough, blood in the cough, then we should suspect that lung cancer may be there. Now, immediately when they go to the doctor does examination, chest examination, breath sounds with the stethoscope, and then advise the X-ray, chest X-ray. In chest X-ray, normally what we see a shadow, suspect, and then if we suspect, if chest X-ray is fine. But if chest X-ray doctor suspects something, definitely then we can go for a CT scan or MRI, depending on further report comes. Sometimes we need to go for a bronchoscopy, and what we do is we pass a instrument like this through the nose, and it goes to the respiratory tract, to the lungs, and then from there we take a tissue and get the examination done whether lung cancer is there or not. And that is called the biopsy, and biopsy gives you final diagnosis. When we take out some small piece, and when we see in a pathology lab, and then we report this, whether it's a lung cancer, which type of lung cancer further. Now, to see whether cancer is only spread to lung or maybe spread to some other sites, again to see the stage, because based on that the treatment starts. For that we do the PET scan. PET scan is a whole scan of the whole body, and we see somewhere else it is there. So If it is a secondary cancers in the lung, then most commonly somewhere else, the baby intestine or a breast or a liver, we will find some primary in the PET scan, and then we can go accordingly. And if it is like this, it means it has already gone and spread to so many stages. It's almost stage 4. Then surgery is not the solution. Then we'll see whether chemotherapy or radiotherapy is helpful. So this is the one basically example how we diagnose it and how patient presents. So lung cancer was the most common cancer in the men, and the breast cancer is most common cancer in the women. Every 4 minutes, a woman in India receives a diagnosis of breast cancer. Almost 14% of all tumors. This is one of those cancers. Breast cancer is one of those cancers. If detected at early stage, it is curable with surgery, chemotherapy, and radiotherapy. So this is one of those cancers which is treatable, curable, but the thing is, it should be diagnosed at the early stage. Normally, we see breast cancers are post-menopausal after 50 years, but nowadays incidence is increasing. Even in late 20s or 30s, we are seeing the breast cancers. Now, what are those symptoms? How person knows that there may be a breast cancer? If there is a lump or a mass in the breast. So this is like self-examination, especially we advise for those who had a family history. Otherwise, everyone should know how to do self-examination because breast cancers are very common. So if there is some separate mass or a lump, if there is a change in size, shape of appearance of the breast, any skin changes, any change in position of the nipple or areola, or abnormal nipple discharge, blood discharge, or some nipple discharge. This does not mean that it will be cancer only. This means if this should be checked by doctor examination, then FNAC or maybe ultrasound or mammography, and then we'll confirm whether cancer is there or not. Again, just like we talked of the lung, now how with this breast cancer can be diagnosed. Symptoms, I have explained you some change in the consistency. Then surgeon examines whether lump is there or lump is already there, or also there in the armpit because that spreads commonly site in the axilla. Then ask for an ultrasound or the mammography. And again, that suspects, yes, this may be a cancer. We go for a FNAC needle diagnosis or a tissue diagnosis, what we call biopsy. That gives you final diagnosis, but also do the X-ray, CT scan or MRI, how far it has spread, ultrasound, abdomen, whether it has gone to the liver because these are the common sites, and then again, whether it has gone to the distant site like brain or other things, we do the PET scan. So CT scan, MRI, ultrasound, PET scan is basically to see whether it's early stage or a late stage. Biopsy or FNAC is to confirm the diagnosis. Similarly, cervical cancers, again, very common, but with the help of now we have a screening test like pap smear, a human papillomavirus infection, and there is a vaccine for cervical cancers now developed. With the vaccine, with the early screening, cancer of the cervical cancers are decreasing now. So we advise every woman who go for an annual checkup after 30 years to go for a pap smear report. It can be prevented by a vaccine, and nowadays adolescent females before marriage, means 12 to 18 years, we advised the vaccine for human papillomavirus. Apart from this, there's liver cancers. And now liver cancer, one very important factor is the alcohol. And because of increased incidence, increased intake of alcohol, even in young people, we are seeing the cancers. And the other infection is hepatitis B. Again, that it can be prevented by vaccine. Cancers of the intestine and the stomach, diet plays a very, very important role. because now diet is changed to more of a refined flour. There's a lack of fiber, so that is a lack of protection of the from the toxins, chemicals. So that is the risk factor, and incidence of cancers of the intestine is increasing. Now, what are the warning signs? Again, these are the warning signs to detect early stage. Warning signs does not mean cancer is there. Warning sign means it is giving you warning, get yourself tested. Go to a doctor, get yourself tested. If it is cancer, early stage, get treated. And if it is not a cancer, don't worry about it. Or maybe doctor may say remain in follow-up. So means one should get it checked. This is warning signs. Warning sign does not mean it is cancer. Now, what are those warning signs? Unusual bleeding or discharge from anywhere. This may be in the cough, this may be there the vomiting or the stomach, or any other side, or from the anal area. Change in bowel or bladder habits. 1 or 2 days because of change in the diet or a traveling. This may be there, but if it is there persistent, maybe for last 15 days or maybe a month, definitely should consult. Any ulcer which does not heal, a sore which does not heal, a non-healing ulcer, because it maybe the diabetes is again very common factor in which ulcer does not heal. It takes time, but cancers are also there which lead to the ulcers which does not heal. A cough, a nagging cough, irritating cough, allergic cough, again very, very common. But important thing is, along with the cough, if there is a heaviness of voice, what we call hoarseness, then these are very important factors. Decrease in weight, significant decrease in weight. We are not dieting, nothing, no further, no physical activity to decrease in weight, but person is losing the weight. Change in the mole or a wart, suddenly mole becomes large, itchy, and that it means this mole may be turning to malignancy. Indigestion or difficulty in swallowing. Again, that may be there because of gastritis or some other part, but yes, one should talk to the doctor. Anywhere if their body shows lump, that lump does not always mean a cancer. A lump means get yourself tested, only this. Sometimes there is a lump, multiple lumps of the fat in the body, they are not the cancers. Apart from this, in the breast we talked. So what we talked various types of the cancer. So we talked till now what is cancer, what are the various stages, what are the common types. Smoking leads to lung cancer, smoking leads to many other factors. Early warning signs we talked. Now, can we prevent it? Yes, prevention is better than cure, and it is very, very important for the cancers. As we said, cancer is now a lifestyle disease. In the lifestyle, what has changed? In the last, again, the 15 years or 20 years, and especially in those last 5 years, we have become very comfortable with the technology and the diet is changing. So two changes especially has occurred. We have become physically inactive, one thing, and we are eating a lot of food which is giving you fast energy. So we need to maintain the lifestyle healthy. It's not something very big. It's not something rocket science, but small, small things in the right direction. Now, what is that right direction? You go towards nature, that is the right direction. You go away from the nature, that's the wrong direction. And what is happening nowadays is we are going against the nature. In the diet, as a medical people, we do not say you need to do dieting, except there is a huge weight, then we recommend, but again, medical supervision. So we said eat right in quantity. Now, right quantity means do not fill your stomach completely, fill your stomach only 80%. Means you eat, you have a meal and do not full yourself. Keep some space. Quality is very, very important, because if quality of food is not important, not there, then there are a lot of infections, especially in the monsoon season nowadays. We are seeing the MBBS, the parasitic infection, the cholera, hepatitis, very, very common. And the types: carbs, protein, fat, vitamins. We need to take all those. So we do not recommend dieting, but right means balanced diet. We need to take it. And it is the food, so is the mind. As the mind, so is the man or a woman. Food is very, very important. So what we eat, that makes our physical body. So what should be the part of our diet? Whole wheat flour. Very, very important. It has changed to refined flour, and that has led to the development of cancers. Rice, pulses, millets, very, very healthy. 23 was a year of millets, and India led in its role of millets. Somewhere we forgot the role of millets. Millets are very healthy for the health, very healthy for the environment also. Eat plenty of salads, vegetables as seasonal. Again, give importance to seasonal. Unless you are allergic to milk, you can take milk or curd. High fiber food like oat bran mueslis are now available. Just like veggies, add fruits to your diet. Again, just like vegetables, seasonal fruits. And one more thing important is the different colors. Because fruits contain different color, means they have a different vitamins, and body needs a different vitamins and minerals. So fruits variety in different color. High protein we need, especially those who are going for physical activity in the gym. Sprouts, natural protein is very important. Go to the gym. That's I'm not saying no, but do not buy the protein or these chemicals, because they have some steroids in the protein which increases the muscle mass, and that is affecting heart, that is affecting kidney. So natural protein is the best. Snacks is there. There are many healthy snacks, and this is the combination of a walnut, pista, almond, and chana. That is very healthy snacks combination. After maybe 2.5 hours after a meal, when you feel hungry, one can have this. Again, people say walnut cannot be taken in summer. It's a small quantity, maybe one or half or one walnut in a day. That will not give rise to any issue in the summers. Apart from this, there are many snacks like makhana, what we call the foxseed, the murmura, the Indian snacks. They're very healthy. Even the peanuts are healthy. But what we do is we fry it in a lot of oil, and then put salt over it, and then after that we take it with the alcohol. So everything becomes bad and bad. So do not take alcohol. Do not add salt over it, and if you require frying, use very little oil for the snacks. This is like balanced diet. We need healthy carbs, protein, fat, and vitamins. Now, what is healthy carbs or unhealthy carbs? Refined flours are unhealthy carbs, and the whole wheat cereals are the healthy carbs. Body needs everything, so that's why we need to take everything. Then do not go for dieting. Where fruits and vegetables, they're very healthy, seasonal, variety in colors, so make your plate colorful. Preserved food, fatty food, fried food, chips, namkeen, sweets, alcohol, these all should come in a restricted list. Restricted means avoid as much as you can. So how we can change our diet to reduce the incidence of cancers? Small, frequent meals, have a variety of food, right quantity, do not overeat it, have a right quality, clean food, hygienic food, eat slowly, and then light dinner. Small frequent meals mean breakfast, lunch, and dinner. And out of three major meals, the lightest meal should be the dinner. And do not sleep 2 hours after the dinner at least. Do not lie down. And what we are seeing nowadays, everything reverse. Rather than small frequent meals, there are large bulky meal, and that is the heavy dinner. And we are eating a bulky quantity, large quantity. So that is the leading to more cancers. Obesity, if you remember, obesity is mother of many diseases. So how to prevent from that? We need to reduce the weight, and it's not only the weight. We talk about the BMI, body mass index. So weight upon height square. No need to remember the formula because you can Google it. You calculate your BMI. They'll ask weight or height and give you reading. Important thing is 18 to 25 is normal, but for Indian population, even 23 to 25 is high normal because we have a tendency for the fat deposition at the points. Again, water is very, very good and detox. How much water? Weight multiplied by 0.03. That's about 60 to 70 kg, 2 liters of water. One glass is about 250 ml. So about 8 glasses per day. If you are lucky and if you are very lucky, I'll say again, you get a good sleep. That is about 7 to 8 hours because 40 to 50% people do not get good sleep. So out of 24 hours, 7 hours, 8 hours, you get a good sleep, 16 hours left. 16 hours, 8 glasses means after every 2 hours, 1 glass of water. It's just a rough formula. But this is minimum. More than this, you need to take if you are doing a physical activity, if a humid climate, if your diet is rich in protein or a fat. It is a very important detox. And second important thing is very important is the exercise. If you are doing swimming, cycling, gymming, running, jogging, anything, skipping, fine. But if nothing is being done, then best is the walking. Most economical. How long? 30 minutes in a day, just half an hour. Yes, more than this, you can go for it. But half an hour a day, 5 days. It's not that every 7 days, but if you go for all 7 days, very good. It's called mild to moderate exercise. The speed should be 4 to 5 kilometers per hour. But if there is some joint pain or some issues, then we can reduce the speed or we can break into the walk in the break. But then suppose if we are doing 15 with the break, then we need to do total 35 minutes. Then the effect will be of a 30 minutes. Exercise has a huge advantage. It's not only reduce the cancers, it reduces the blood pressure, it helps the heart disease, it improves the blood circulation, improves the immunity, it gives a good look, free from obesity. So exercise has a huge advantage, And then vitamin D, nowadays people are having this vitamin deficiency. Why? Because we are not taking sunlight exposure. Just 15 minutes of sunlight exposure will give you this hormone. Whether vaccine is there or not, which will prevent cancers, yes, human papilloma virus, which leads to cervical cancers. Hepatitis B vaccine is given for everyone, which can prevent liver cancers. These 2 vaccines are there which can prevent liver cancer or cervical cancers. Otherwise, all cancers cannot be prevented. Yes, in this year only, in January, the Glaxo and Oxford established some cancer immunoprevention program to do more research. It's very difficult to develop vaccine for all the cancers. Yes, if we develop it, nothing like it, but it's very difficult to develop the vaccine against all the cancers. So how we diagnose cancers, we've seen the simple blood test, but not all cancers will be picked up in blood test. Only cancers like prostate or the ovarian cancers, where we call some marker is there, the blood test, that will show the cancers. X-ray, especially in the chest, the lungs cancer, or also shows if there is a lung in the lungs, there is secondary cancers. Ultrasound, CT, MRI, or PET scan, they tell you the various stages. FNAC and biopsy gives you the final diagnosis. So what all screening tests we recommend? A mammography and ultrasound. Mammography in the women after 30-35 years. This may be started early if there is a history of breast cancer in the family. Ultrasound, pap smear in the men above 50 years, prostate specific antigen level, because that measures the prostate cancers. And but again, word of caution, every time if PSA high, it is not prostate cancers, because it may be high with the benign hyperplasia of prostate, what is the normal aging part. And we need to do the complete blood count whether cancer is there in the blood or not. These are different treatment modalities. Surgery means remove the tumors, while surgery, chemotherapy means we give injections, anti-cancer drugs. They are given in cycles, very strong. It is difficult to tolerate from some patients. Radiotherapy, there are advances nowadays in the radiotherapy. We give a radiation to the localized areas, so there's a minimum side effects. Immunotherapy and gene therapy are the latest advances, and research is going on. It is very helpful, still in the more of a research, and some places it is available. A quality of life is very important in decision of these treatment modalities. It's not that every time we need to give surgery, chemo, radio, and when we talk of these everything, a doctor also discusses with the patient or the patient family also. That is very important. It's not that cancer means death. No, we have now cancer survivors, the people who are free from cancers. The only part is early stage. It is easy to diagnose it and easy for complete treatment. So there are numerous ways for cancer prevention and control. One thing is the risk reduction, how we can reduce the risk by changing the lifestyle, like no tobacco, no smoking, no alcohol, healthy diet, doing the physical activity, and the vaccination against hepatitis B and human papillomavirus. So if we can do this, and we all can go for this. This is like risk reduction. This is the important part today what we talked. So reduce the risk for the development of cancers. Then early detection, again we talked. So early warning signs, if we know it, we can go to the approach to the doctor, get ourselves tested. So again, these two things are very important, risk reduction and early detection. Then there are numerous policies or programs, awareness programs, and this is again health promotion. This session is a part of like health promotion. So just to summarize it, do not ignore early warning signs and take care of your health. The early warning signs are significant weight loss. We are not doing dieting, we are not doing physical treatment. Still, there is a significant weight loss, especially in the old age. Any mole increases, cough with hoarseness. In the breast, there is a lump of all over the body. There is a bleeding, there is an ulcer which is not healing. These are the early warning signs. If they are there, go to the doctor, get yourself tested. Say no to smoking, active as well as passive. Smoking is harmful, and even the alcohol. Eat seasonal fruit and vegetables. And color, make your plate colorful. In the diet, salt should be low, sugar should be less, and fat should be less. Because there are many cancers, of the ovarian cancers, the hormone-induced cancers. They are more when their diet is rich in fat. And exercise, very important. There are numerous advantages. Exercise regularly to keep your body weight under control. Exercise is very important. And we said 30 minutes in a day, 5 days in a week. This is minimum. You can go for more than this. You can go in the morning as well as evening. So keep yourself healthy. Health is the biggest wealth. With this, we come to the end of the session, and we say together we can help create a peaceful and healthy world. So with this, have a great day. Thank you for the patient hearing. Now session is open for any questions.
Yeah, good evening, Dr. Vineet. Thanks for a very nice session on the cancer prevention. So there are two questions.
Yeah.
The first question is usage of mobiles, and does it has any connection? Mobiles. We are using mobiles a lot. So does it have any connection, or is there an incidence of the more brain cancer compared in the last 10 years compared to earlier? Second is that the mobile towers. Now we also see many mobile towers. Are they also related to some kind of cancer? There is a third question. Okay, yeah. You can answer. I'll ask the third question later on. Yeah.
Very important, sir. Mobile. It's not that only it has the only role in the breast cancer, brain cancers. the issue of the mobile or technology, you all are the technical people, actually, I say. The issue is technology is making us indirectly also redundant, physically inactive. So mobile, I'll say, the radiation effect, yes, it has a radiation effect. We use on the ears, it has an effect on the brain. Definitely, there is radiation that leads to increased brain cancers. Definitely, one important thing. And we are not doing activity because with the use of mobile, actually, and nowadays very common, apart from the cancers, if I say, hearing loss is very common. People are using the hands free, and the whole day they are using hands free. That is leading to the hearing loss, again, very commonly in the young people. So mobile as such is leading to radiation, leading to brain cancers. Mobile through the hear also causing hearing loss, and indirectly further, because of the use of so much technology, that we are isolated, we are not talking much to the people, and we are not doing physical activity. That is also having a effect on many health diseases, maybe the cancers again. Yes.
The next question is that you told to avoid salt. So instead of normal salt, if rock salt is used, is it helpful?
Sir, very important. Sir, rock salt or the white salt. White salt is, if you remember, the more the whitish thing anything is, it's cleaned by the chemicals, actually. So it has the chemicals. Definitely, rock salt is better than the white salt, definitely. But still, even in the rock salt, we should not use so much in abundant quantity. Why? Because even all the vegetables have a sodium. I'm not saying in the vegetables or a pulses or routine food you should not add salt, but as an Indian people, we are very much liking the spicy food, spices basically, the pickles and everything, and even every salad we add salt over it. So that is not good, actually. That's the only thing I'm saying. Otherwise, rock salt is definitely better than the white salt.
Yeah, thank you.
Welcome, sir.
So, doctor, there was a question on Q&A session, like, is DCIS cancer? I don't know, is it from whom is it? It is asked, but it's a question there. Can you answer the
Okay.
question?
Yeah, very important. DCIS means a ductal carcinoma in situ. Short form of this is DCIS. If you just remember D, just forget about D to now. The DCIS means CIS, carcinoma in situ. If you remember what we talked in a very initially, we said carcinoma remains limited to the organ from it is arising. That is like only remain to the organ from where it is arising. So carcinoma in situ means it is a cancer, but it is in the very early stage, remain localized to the organ from where it is there. It is very early stage, it is cancer. Important thing, it is cancer, but very early stage, it has not spread to another side. So surgery treatment will be very helpful, and most of the cancers which are in this stage, CIS, DCIS, ductal carcinosis in the breast, that is treated by the general surgery or maybe chemotherapy, and it is highly very good treatment modalities, and prognosis is very good. It is almost cure, we can say, DCIS.
Doctor, and the question like yeah, for cancer, many people when some kind of cancer happens, they normally go to Mumbai. Is there any specific reason the cancer treatment, like suppose in Calcutta or other places, Mumbai is a better place for a cure? Or I don't know, maybe the hospitals are big, or because uh, cure should be available everywhere. That is what I understand.
Yes, sir. Very important question, sir. Now I'll say, I'm a practicing doctor in Delhi. So almost every the whole world is connected. most of the time we are, whatever treatment is there, even in the US, now we have available at the India and all metropolitan cities, and even other metro cities also. Other than this, we have a Lucknow. Apart from this, there are many other cities. We have a well-developed centers and well-defined treatment modalities are available. So it's not that every cancer we need to go to a maybe. I'm not against it that Mumbai, or I'm not going against that Tata Gas Institute. Yes, earlier on, because they had a lot of experience. Nowadays, so many cancers that we see, even every place, people are more experienced, and the treatment depends on the experience. Treatment depends on the various diagnostic modalities. Now there's all those diagnostic modalities like CT scan, MRI, PET scan, very high level of ultrasound. They are available at almost every places. The same drug is available at every places. So it's not that the treatment can be done only in this one city or not other city. Even the small place, it can be done.
Sir, can I ask a question?
Hi, please, sir.
So my father passed away about 1 month ago,
Okay, sir.
and he was diagnosed with oral cancer, and he was diagnosed in July last year, but he couldn't finish an entire year after that. And there is a specific test which I found out through using artificial intelligence, and that is the PDL1 test, and which was surprisingly not suggested by any of the doctors, whether in Chennai or Delhi. And when the result came out, it was astonishing because that was just two months before he passed away, and he could have been a very good candidate for this medicine called pembrolizumab, that is Keytruda. And we started him immediately, but unfortunately, I guess I was too late. But how, I mean, although we are having the basic level of awareness, that thanks to people like you who are giving it to us, but how do you, isn't it becoming very difficult because the doctors these days, they're just following a standard template for every individual, and not specifically for per person basis? So what do we do in such cases, doctor?
Yes, sir. I do agree with you at some level, but the cancer is actually evolving. We are gradually learning. We talked of the gene therapy, we talked of the immunotherapy, we talked of even the diagnosis part. Now, many cancers are diagnosed at the DNA levels. Slowly we are changing. Slowly again, I'm saying this is a I have no issue in saying that as a doctors we are also learning this part. Maybe the some blood cancers, we have very few drugs now, various modalities are now available. It is there. So if I say that as a doctor we know everything and this, no, it's evolving, and it will keep evolving. And that's the second part is, that's why I'm telling about the prevention part. What is happening is we are not talking of the prevention. We are going in the treatment, and we are not talking of the root cause. So we need to treat the root cause. Yes, everywhere this test is not available, what you talk. But the issue is now we are slowly changing to the cancer treatment for the cancer diagnosis, and now we are giving the medicine based on the DNA actually. So genetic mapping is done, and within a 5 years, I think the whole cancer treatment, what was there in the last 10-15 years, will actually change it. So this is a transition stage, I can say, or this is a slowly evolving stage. We are unlucky that in this fight with the cancer and the doctors, or cancer and the healthcare, actually it is a cancer which is winning, and we as a healthcare people, we are losing the battle. Somewhere the awareness is not there, and somewhere we are not talking on the prevention part also.
Dr. Vineet, thank you so much for your answer. I have a friend, Vibha, who is currently undergoing chemotherapy, and she is diagnosed with breast cancer. She would like to ask a question. I'd request Vibha to ask, please.
Yeah, please.
Good evening, doctor.
Yeah.
Thank you so much for a wonderful session. Firstly, it was quite helpful in knowing the do's and don'ts of the whole procedure and the whole time frame. I have a doubt whether this chemotherapy, as suggested by the doctor, even if we realize in the middle of the treatment that the tumor is disappearing, or through any scans or any PET scan which is done in between the chemo session, if we figure out that the tumor is not there anymore, is it advisable to fully finish all the sessions still, whatever is prescribed, those 16 sessions that they usually prescribe of the chemotherapy?
Very important, ma'am. Whenever we talk of the chemotherapy doses, again, that's based on the research that yes, we need to give maybe 16 cycles, or we need to give a 6 cycles of this, because that lead to complete disappearance or maybe reduction in size. Now, if you think that after every 6 cycles, if the cancer size is reduced, then we should stop it, but it does not, it's reduced. And very important thing is, cancer means we are seeing the cells. Maybe any test, you do the CT or you do the MRI, the size may reduce, or you may not see it, but cells will be there, because cells cannot be picked up. They're so small, so tiny, that even a 1 gram of mass contains almost 10 to the power 9 cells. So that cannot be picked up. That is the issue with the cancer treatment, issue with the cancer diagnosis, early diagnosis, and the treatment effect. So this recommended part is go with the appropriate cycles of chemotherapy. Yes, if person can tolerate it. If person cannot tolerate it, obviously, that's why I said quality of life is again very important in this part. Quality of life. We were not going to see that person is having a problem with the cancer. It becomes worse with the treatment. Yes, initially it may become worse, but we know we are doing it for good. But in between, if we feel no, it is becoming really worse, then we need to change this part, definitely.
Like how my friend Seshant had mentioned about that PDL1 test, I had checked with my doctor and he said it's not required because I don't know. According to him, he said it's not required. I've been diagnosed with breast cancer grade 3.
Stage 3 or grade 3?
Grade 3, stage 2.
Okay.
And my ERPR test was all triple negative.
Okay.
So in that case, he said maybe PDL1 is not required. Is that correct?
The issue is, not every cancer, the ERPR, if we just take the example, ERPR is specific for the breast cancers. Okay. Now, it depends that if ERPR is positive, then we need to give a different medicine. So these are some tests, hormone test or a receptor test or some genetic test, that they're individual cancer wise. So in the breast, ERPR is more important. If ERPR is positive, then we need to give a different treatment. If ERPR is negative, then we have different medicines. So in this case, in the breast cancers, ERPR is more important rather than the other cancers.
Okay, all right. Also, there was this particular treatment, not for cancer, but otherwise they have this hyperbaric oxygen treatment that is happening in all of these wellness centers. Is it advisable to do that, which increases your oxygen in the body during the chemo sessions or something?
Again, Vibha, I said in this, please consult the doctor again. Not go for any other, because the concept they say, somebody says do not take adequate diet or nutrition, then cancer cells will die. No, we need adequate nutrition. Again, hyperbaric oxygen therapy means we are giving more oxygen, but abnormal cells will also take more oxygen. They can also grow. So it's with a word of caution, we need to go for this. Again, it depends on many things. As you said, stage 2, grade 3. Stage 2 means has it spread to some other organ or not? It was invasive, or what was its size? So it will depend. I'll say no. Do not go for surgery, chemotherapy, radio, and go for only hyperbaric oxygen. No, that's not right. That's not right.
Okay, thank you so much, doctor. Thank you. That's very helpful.
Thank you.
Doctor, there is one thing, like it is told that if you stop taking sugar, then cancer cells, die or whatever. There is some truth in that?
Sir, same thing. I was just talking to Vibha according to this. They say don't take sugar or don't take some nutrients, so there will be less sugar, so they will die. It's not even the normal cells also will die. So this is not the right thing. Yes, we say do not take excess sugar because that is going to harm the body, but less sugar will not treat you against the cancer.
Sir, one last question, if I may.
Yes.
Sir, a lot of rounds are going about. I don't know whether this is scientifically backed. I want to know your opinion about the usage of medicines like ivermectin and fenbendazole. What do you think about this? Because just looking at the scientific properties of the medicine and what it does with the body and what it inhibits and what it promotes, it seems like it could be a miraculous drug. But I would like to know your opinion on that.
Sushant, again, first thing issue is take see any medicine is actually a chemical. To be very frank, any medicine is a chemical. Any chemical, when we take it, if it is water soluble, it will come out through the kidney because it will produce some metabolic products, or if it is water insoluble products, then it will come out through the liver. So these are two ways how body metabolizes the chemicals, and if it stays in the body, it may have some effects, good or bad or both things. Generally has a good effect as well as the bad effect. We give medicine when only good effect is more than the bad effect. So generally, there are some side effects. People say all allopathic drugs have side effects. I said any chemical will have side effects, or even a natural product, if there are some chemicals, will have some side effects. Now we give the any drug if there are more benefits are more and the disadvantages are less. Similarly, vaccine, we have seen the COVID vaccine. When we say COVID vaccine will prevent major infection, but it may cause mild infection. So we gave the COVID vaccine. Similarly, we give a vaccine. So ivermectin or piperacin is basically only when really required under medical supervision. Only take then, otherwise I do not say do not take it.
All right, doctor. Thank you so much. Doctor, where do you practice? I mean, what if we would like to come and meet you and just speak to you more about this?
Sushant, I'm in Delhi. We can always connect on the mail and then we can discuss. I do not know from where do you stay?
I stay in Chennai, sir.
Okay.
And my father was also operated in Delhi.
Okay, sir.
He was operated in Action Cancer Hospital by Dr. Rajesh.
Okay.
Yeah. So in Delhi, if ever somebody requires any help, I would love to get in touch with you.
Definitely. I'll share the mail with them, and we can always connect on the mail, because sometimes it's most of the time actually phone. It's becoming difficult. So through the mail, and then we can definitely connect it.
Yes, and I would like to thank the IIT-KGP alumni network for organizing this. Thank you so much.
Thank you, sir. Thank you for such a interactive session, I'll say.
I hope everyone's query is solved, if I'm not wrong.
Thank you very much for a lovely session.
Thank you, Dr. Vineet, and thank you, participants, for making this session a successful session. We'll be meeting again with more topics and more interactive sessions. Thank you, Dr. Vineet, for this interactive session and a very informative and helpful session. I hope everyone finds it useful and helpful in their lives. Thank you so much, everyone, for joining.
Thank you.
Ma'am, requesting you to please share doctor's email ID with us, please.
Sure. I'll keep this in mind. I'll share the email ID for sure. Thank you so much.
Yeah.
And ma'am, the session recording also, if possible.
Yes,
that
yes,
would
the
be
session
great.
recording will be uploaded. Yes, no worries, sir. The session is being recorded. Yes.
Thank you.
Thank you.
Oh, thank you so much, everyone, for joining. Thank you, Dr. Vineet. We can leave.
Thank you.
Thank you.